All right. Well, welcome back. Thank you, everyone, for joining. This video, this podcast, we are looking at the question, what is it like to be a chiropractor? And I reckon, Endre, this is probably one of your favorite questions. What do you love about being a chiropractor?
That's true. I've been asked this so many times, and it's exciting every single time. You know, the most exciting things is definitely the results.
Mm.
When people are just they have a problem and it's bothering their life and what they can do, and then you just do your examination, history, and everything you need to make sure that this is a problem you can treat, and then they just respond like crazy, so fast.
Mm-hmm.
So fast. Yeah, you can literally use 15 minutes and get someone that's been in pain or has had a problem for a decade better, significantly better in 15 minutes. Obviously, that's not every patient.
No, and don't you love the shock as well? Because as when you find someone comes in for the first time and they come in with something you can fix quite quickly, which isn't, as you say, it doesn't always happen, but a lot of the time you see that kind of thing, and then you say to them, right, well, we'll treat you. You might just do one adjustment, and sometimes if they've never been to chiropractor, they're thinking, well, is that really going to do anything? And then they come back the next time and it's like, wow, I'm like so much better. I mean, often they're not perfect, but like so much better, and just like the shock on their face of the power of what we can do for some people. I love that. I mean, I almost love that more than if someone came in and had the expectation of, yeah, you'll just take this straight away. I hate that, because then
oh yeah, that's terrible. That's terrible. And this is even worse. It's like, oh yeah, my friend came to you, you fixed them in 2 treatments, so now I just want you to do the exact same thing to me.
Mm-hmm.
And then it's like, yeah, but do you have the exact same problem? And obviously they don't, because it's a complex world.
Yeah, and then they might have diagnosed it themselves as the same problem because the pain might be similar, but you realize actually it's a different issue, and it's going to take a little bit longer. So it's better to have it other way around. It's better to see that second patient first and then the first, so you're building upon it. But yeah, I agree. Results is something I think as chiropractors is what drives us through the day, doesn't it?
And sometimes it's even the same patient that's coming back, and like they had low back pain on the right side. That's like an SIJ problem or pain with walking or something. And then you get them better. They come back a year or 2 later, and they're like, "Oh yeah, it's just the same thing." And now it's pain on the left side, and it's radiating down the leg, and it's painful to bend forward and sit. It's a completely different problem, but they're like, "Oh yeah, it's just the same thing." And that's always, it's weird how poorly people remember their own problems sometimes.
Yeah, it's interesting. It surprises me sometimes. Some people, they don't recognize the progress. So they might come in and they're hobbling in and they're really in pain, and then they come back next time and they're just walking in, and then you say, so how is it? And so it's all right. And I'm like, it looks so much better. Why are you not saying so? Why are you not giving me that satisfaction?
Yeah. And then you do the SLR and just like check. Yeah, this was painful with 15 degrees elevation the first time, and now it's like 60 degrees, and they're like, oh yeah, that is better, isn't it?
And that's a good point. Sometimes I think you have to show people their progress, and that's why this is something I'm trying to get better at, is having some outcome measures at the beginning. Like, for example, if someone says it's painful when I walk, then ascertaining how far do you need to walk until you start getting the pain. So they might say, oh, I can't walk more than 10 meters without pain. Next time I come in and say, oh yeah, I walked half a mile and then it was painful. So the answer could be the same. Is it painful when you're walking? Yes. But actually they're better. But if you didn't ascertain the length and distance, then you wouldn't know whether they're better.
Yeah.
And it's interesting how some people just kind of almost blank that. And then you point it out to them, as you say, and then they realize, oh, yeah, oh no, I am better. Yeah, or at least improved. So
yeah, that's true. Because often they will say, oh yeah, it's still painful when I'm walking though.
yeah, and then you
And it's
dig
like,
deeper and you realize,
yeah,
because like sometimes the first thing that they say, I'm thinking, oh, I know better, or sometimes I think, oh gosh, they're worse, and then they keep talking, and then you go, no, they are better. So
true.
yeah,
And it's as you said earlier, like they don't believe you the first time. It's like you're only at just one segment, and they're like kind of skeptical, and you can see in their face like they're kind of skeptical, and then they come back the second time and it's a day or two later, and they're like, that was pretty amazing. Like just the change in people's perception.
Yeah. And obviously, I think I reckon with some people they are wondering, did it change from what you did, or am I just having a good day? So, and I think as you go through the course of treatment and more time goes on, they got more evidence that actually, yes, I am better. And then they start to build their enthusiasm for it, I suppose. So, yeah. But equally, I think what is the reverse of that, and what's not nice about chiropractic, is that when people come back and they're not better, or those patients that you're struggling with and they're just not getting any better, and particularly those that really highlight that to you and really get frustrated with you, and obviously that's that's partly due to how you communicate with them, or even worse, if you manage to aggravate a problem, which is very, very easy to do with some people, to aggravate a problem as well as get someone better. So particularly when you first start and you don't have much confidence or experience, when you make someone worse, you almost, or they're not getting better over time, you start to panic a little bit. Oh, am I going to be able to do this? But as you gain experience, you know that this sometimes happens, and you've got evidence of yourself being able to reverse that quite not too difficult. So it's, you learn the process. So yeah, I would say that's also something that's not so nice about it. But
yeah, but I think it's, I don't know if I totally agree with myself, but sometimes it's more helpful if you made the patient worse, or if they were sore after treatment the first time, than if you did nothing at all. At least you did something. I feel like then you have evidence of either you did something and it's going to get worse before it gets better, or you're just not going to do that anymore. You try something else.
That's true. So you're saying that it's better to it sounds bad when you say
that's why I don't agree with myself necessarily, but sometimes it is.
It's better to make someone sore than have no change at all. Yeah. You want to see some change, don't you? Yeah, it's kind of true, I guess. Depends on the person. I mean, but at the same time, you rather someone not be sore than, yeah. But anyway,
be sore. Yeah.
I get what you mean though. Yeah. So what about so obviously chiropractic is, you kind of have, in my head, you kind of have two sides. You have the kind of the knowledge part, gaining knowledge about the human body, how it works, biomechanics, neurology, etc. And then you have the art side of things, the skill of acquiring a skill, like you might acquire a skill with playing football, becoming the best footballer you can. You have the knowledge side, but you also have how well can you kick a free kick into the top corner. And as you the more that you do it, the better you get. So how does that aspect play, and which one excites you more, gaining knowledge or gaining skill?
Good question, Dr. Steven Hulme. Which one excites you more? I think it depends which day you ask. Some days or some periods you just want to get better at like technique and skill and how to actually move a bone that needs to move. But sometimes you just want to know which bone to move. But yeah, I don't know. I think often I consider this like plumbing, like handiwork.
Yeah.
If you can't move the bone, you can't move the bone.
Mm.
Or if you can't improve the function, let's say it that way. If you can't improve the function, you can't improve the function.
Mm.
And I don't see how that's gonna help the patient.
You just can't have one without the other, can you? Because
Yeah.
You could be the best adjuster in the world, but if you don't know what to adjust, or if you don't know what you need to improve on someone to get someone better, then that great adjustment can actually just make someone even worse than they are, because you don't know where to apply it. But at the same time, if you find the problem but you're unable to fix it, then that's also pretty useless. So you know what, just thinking out loud here, I think that the latter is more useful. I think it's more useful to know what the problem is and what to do about it, even if you couldn't sort it, because at least then you've moved them forward a little bit. But if you had no idea where to or how to help someone, but as soon as you knew that, then you could actually help them. You probably less helpful, aren't you? Unless you were going to take a bit of a guess.
Yeah. Okay. I'm gonna agree. Knowledge is most important. Because if you adjust that mid-thoracic beautifully on a patient that got cancer,
exactly. Yeah.
You are not helping the patient. And even less severe than that, if you have a patient with an SIJ problem and you can't move it, you can just tell the patient, I'm sorry, this is really difficult to treat, and I know this guy just down the street or somewhere else, to that can help you. It's like your tooth problem. Went to a chiropractor, found a problem with the filling or whatever, and then he knows the problem, but he just doesn't have the knowledge to help it.
Yeah, you didn't have the skill to do what he knows he needs to do. Yeah,
but then it's still helpful to refer you out to what needs to get done.
Exactly, because step one is finding the diagnosis, isn't it? So yeah, no, you certainly can't have the one or the other, and I think it's well, yeah, you can't, yeah.
But then if you don't have the skill at all, then you're just, I don't even know what you are, a counselor.
Yeah, well, you're like a triage.
Yeah.
Yeah.
That's, but chiropractic sounds way more exciting to me, for sure.
Yeah. Having said that, if you're a qualified chiropractor, you are always going to have a foundation of skill and knowledge. So so yeah, you're going to be able, and you tend to be better at one or the other, at least to start with, and so you'll generally do okay, provided that obviously you keep getting better at both and you don't neglect one over the other, for the reasons we basically discussed. But yeah, I certainly find it. I think they're both quite satisfying, though, aren't they, to improve upon?
I'm gonna change my answer for the 7th time. I'm gonna say knowledge is the most important, because of the reasons we just discussed. But when I find a problem, I'm not that that's not what excites me. But sometimes you move that bone just beautifully on the high-low, and that's more exciting.
That's true. Yeah. That's true.
Final answer: skill is most satisfying. Knowledge is most important.
Yeah. I think you're right, because I performed some adjustments that I thought, that just moved so well, and then they just didn't get any better. So that was just completely useless, even though it gave me the satisfaction at the time. So having said that, also, because I found the right area, I've also performed adjustments that I didn't think were particularly great, and they come back better next time. So whether that was just the way that their spine was and I couldn't do much about it, or maybe that was just because it wasn't a very good adjustment. Either way, they still got better, even though I didn't have the highest level of skill in that moment. So you don't always need the highest level of skill with every person.
No.
I think you mainly need it with the more difficult ones. There are some people, it's just like there are 1,000 things you could do with them, they're going to get better. And there are some people, there's one thing you need to do. And if you don't do that one thing, they're not going to get better. Like that patient that I had with knee pain ages ago, and I was adjusting his L5 for ages and he wasn't getting better. And then eventually my last resort went to L4, knee pain went away. And that's like a few months after adjusting L5. I mean, at all, not quite like that, but and that really like that surprised me because I thought, well, L5 is right next to L4. Surely, we know that adjusting segments next to each other have an effect on the neighboring segments. But for him, and so a lot of people, they would have got better, but for him, he needed that L4 adjustment. And if he didn't get it, he wouldn't have got better. Well, at least that's what it appeared to be like with that particular scenario. So,
oh yeah, results is always the most satisfying.
Yeah, exactly. Yeah.
That's
I much rather perform an adjustment I didn't think was that good. Maybe I didn't get any noise out of it. It wasn't very satisfying or whatever, but they come back much better than if I do a really satisfying adjustment and they come back and they're no better. That's not nice. But
yeah,
I suppose from an arrogant point of view, it's nice when people are singing your praises.
Oh, that's very exciting.
Yeah,
it's very exciting. And if the patient aren't complimenting my adjustments, I'll just do it myself in front of them.
Yeah, yeah, exactly. Yeah. So, yeah. So, I mean, I think we mentioned one of them already, but what would you say is maybe some of the things that maybe not so exciting about chiropractic? Maybe some of the things particularly that are maybe less obvious, or some things maybe you didn't necessarily think about until you got into practicing.
I think this was a revelation for me, and it's something you said to me not that long ago. It's like, as a chiropractor, you're in hopefully the same room for 20 years, seeing patients one-on-one with no one else. And if you don't enjoy that, this is going to be challenging your job. I think that could be.
Not something. Something you always think about, is it?
Yeah, no, it's not. It wasn't obvious for me. Obviously, I've been a chiropractor for a number of years and still didn't.
That's what you were doing.
Yeah.
Yeah, because I mean, I remember my auntie saying it, how she's been in the same room for 30 years, and it's actually kind of a lonely job. Even though you're seeing people all day long, it's a classic people's job. You need to like people to do it. At the same time, it's also kind of a in some respects an isolating job. And I suppose the other aspect I kind of realized recently as well that I actually kind of miss, and so it's not a deal breaker. You can do this in other aspects, but there's no team. Well, actually, that's not true. But there's little teamwork. The only teamwork you really have is with your receptionist. That's pretty much it. You can maybe argue that there's teamwork with the patient as well, but not really. It's not like you're working at the same level. You're kind of really, well, I guess it's kind of teamwork because you're giving them the plan, and without them saying yes, well, that's not going to work then, is it? So you have to get them on board, that sort of stuff. But you're not it's not in the same way that if you're in a company, you're running a team of people. I kind of enjoy that. I have that in aspects of life, like in bands and that sort of stuff, how you're trying to bring things together, and that's quite fun. But if that's the kind of thing like you really, really like, and it's essential for you, then probably chiropractic isn't, going to be, if that's a deal breaker for you, then chiropractic probably isn't the one for you, because it is really predominantly a solo task, isn't it?
But at the same time, you can choose how you work. If you work in like a one-man clinic, or if you work with different chiropractors, and then there will be more teamwork and discussion of cases and patients and ways of doing things.
Yeah, that's true, and that's quite fun as well. If you can find a chiropractor that's quite like-minded as well, particularly, and you're working with them, then you can discuss cases, and that can be quite fun, and you can help each other, and that's exactly, that's kind of teamwork, isn't it? So. But there are advantages to that as well. Like, for example, my granddad, he was classically known to be very difficult to work with. and from what I can kind of gather, he didn't really like working with other people. He liked doing his own thing, particularly if you're the kind of person that is, quite fairly controlling and you want things done in a certain way. It's much easier if you're the one doing it. Doing everything. It's a lot harder to delegate things off to team, isn't it? Even though you do have to do that because you still got your receptionist. So yeah, that's interesting. Yeah,
it's true. That's a good point.
So, but final question: if someone's watching this and they're,
can I just interrupt one thing?
Go for it.
One more time. That's a lot of people will find negative. It's like that. How you're tied down to like one location at one specific time. You have this one patient coming in at 1 o'clock and you need to be in your office at 1 o'clock. It's not like you can go to Bali for 2 weeks and just Skype the patients and tell them what to do. Or if you're feeling, I don't know, tired, you can just sleep from 1 to 2 and then work later in the evening. It's quite restricted both in terms of location and time. Yeah,
that's true. That's a big point as well. And that's the part I don't like it, because it adds a bit of pressure. You need to perform at a specific time. Whereas find out most people's job, particularly those that are working from home, they can take an hour's break whenever they like. As long as they do the work that they need to do in that day, then it's fine. They can start a bit later, a little bit earlier, finish later, earlier, provided that they do the work. Not a big deal. But for us, patient coming at this time, we have to be there.
The only thing you can decide is when you book the patients. Like obviously you can decide, Monday mornings I want to sleep in, and then you can book them from 10 or 12 or whatever. But when it's booked, and it's booked a month or 2, 3 in advance, you have to be there.
And there is quite a lot of flexibility, depending on the type of practice you're working in, to how you schedule your diary. If you want Mondays off, not usually a problem. If you want Fridays off, if you want 4 days or 5 days, it's not the kind of job where you have to work 5 days. Like there's some jobs, like, I don't know, if you're working as a nurse, there needs to be a nurse every single day. It's not like there can be a day off for all nurses. For chiropractors, we kind of can. I mean, obviously, the more days you're open, the better, but there's a lot of flexibility in that regard. So swings and roundabouts, as they say. Yeah. Okay.
Clever. Cool. Interruption done.
Excellent. On a question. Excuse me. So yeah, if someone's watching this and they're wondering, is chiropractic something I want to study? What would you advise someone to help them to gain further, more of an idea of what it's like to be a chiropractor?
I'm just trying to think of what I did. I don't know.
True, because you were in that boat, weren't you? You've been treated by someone, so that's one thing, isn't it? To get treated by a chiropractor is one start, and then that's something you did. But before that, you didn't have any experience with chiropractic, did you? So how did you get to the point of wanting to study it?
I don't know. It was more like a light bulb moment. I don't know. I knew when I knew, and I knew that I knew that I knew.
Yeah. Okay.
Yeah, that's very helpful.
Yeah.
Very, very helpful. I don't know if I can even think. I think what I would advise someone to is to observe a chiropractor and observe more than one chiropractor.
Yeah.
To see what their day is like and how they work and what it seems like.
Yeah, I agree.
Yeah, chiropractors overall love their profession. So it's not like if you send them an email or phone them up or whatever, they're going to be like, nah, I don't want to talk about this. It's not between hours. So they're very, very, very open to talking about their experience, both positive and negative.
I reckon in the last, I don't know, 8 years, 10 years, probably observed maybe, I wouldn't be surprised if it's near 30 chiropractors, and I never have anyone tell me down. So particularly if, because chiropractors generally, they want to encourage the next generation, and they also want to encourage, you know, like good chiropractors as well. And as you say, yeah, chiropractors are usually excited about what they do. If they've been in practice more than a few years, they're normally fairly excited about what they do, and they've seen the results in clinic, and so they get pumped up naturally. So, and they're the type of people you need to spend time with, because they'll help you build that enthusiasm, and they'll show you what's great about it. So yeah, I agree.
Sure.
I think observing.
That's digression, but that's one of the great things with seminars when you're a student.
Good point. Yeah.
If you are a student and you want to learn more of if this is something you want to do, because people start chiropractic college and they're not excited, and they find out that's not for them. And it's better to do that when you're in year 1, 2, or 3 than later. But definitely seminars is also, it's like you're talking to, it's similar to observing, because you get to interact with a chiropractor that's enthusiastic about what they're doing.
Yeah, I even knew, I think you did as well, chiropractors that we studied with, and they went to seminars before they even went to college. I think they went with like their mum that was a chiropractor or something like that. So that's, I mean, if you get an opportunity, if you think about studying chiropractic, if you get the opportunity, just go along. You won't understand a lot of it, but you'll gain something, even if it's just the enthusiasm about it and some kind of insight. So
yeah, I remember for me that was one of the most exciting things when I observed a chiropractor. I went back to the same chiropractor quite a few times during the 5 years I was at uni. And it's like the first time I was like, I don't know anything. And then next time I knew a bit more, and then a bit more, and then a bit more. And then you kind of start to realize how much you're learning, because you're in that bubble at university and you don't realize how much you're learning, because it's just all your friends are learning the same thing and they know it, you know it, and then you just talk about it like it's normal.
Yeah.
And then you compare yourself to your previous self and you realize, oh yeah, this is definitely going the right direction.
Yeah, it's true. Yeah, I mean, we start off college knowing nothing, and then we go up in the same rate. So you start to think, how much do I know? But then you go back and, to your family or to your friends, you start talking about it, and you think, oh, actually, yeah, I do know a few things now. and that's quite satisfying. But yeah, as you say, I've done the same thing. Like I've observed similar chiropractors, like some chiropractors, a few times over the years, and each time you go, you gain so much more, because you understand, oh, right, that's why you're doing this, or yeah, so that's fun.
And yeah, you realize what questions to ask.
Yes,
because
exactly.
In the beginning, you don't even know what you don't know.
No, exactly.
And you don't understand what you don't understand. But then you realize what, yeah.
You got nothing to latch onto. So so I think the first time you go, you don't ask very many questions. Good. Okay. Well, I think in summary, what is it like to be a chiropractor? It's I think it's quite exciting. It's dynamic. It's up and down. But I think overall it's exciting. And I think what's even more exciting is it gets more exciting the further you go along. I've certainly experienced that. I have days like Friday, actually, last Friday, very, very busy day, and I loved it. There are some days where I get to the end and I think, I could just keep going, and it's just so I'm so pumped up. And there are some days you get to the end and you think, I cannot wait for this day to end. It can be a bit like that, but what is great is that the better you get, the more experience you get, you start getting better results. And then you get less of those days where you just wish it would end, unless you're just really tired or having, I don't know, something else going on the side. But I think overall it is exciting. Would you agree or want to add anything from there?
No, yeah, 100%. It gets, it's very exciting. And sometimes the worst thing you experience at work one day is like, oh, no, not more patients. Because when patients stops coming, you can't keep working, even though it's exciting. It's kind of over. But yeah, for sure.
Yeah,
it's very, very excited, and there is some things that you could consider negative, but I just feel sorry for people that's not chiropractors.
I'm so glad you said that, because one of my questions in my head before we started this was, I need to get you to say that, because you said that so many times and I find it so funny.
Yeah, but like, I don't get it. Obviously. Poor people.
Endre,
Poor people.
you're so naive.
Yeah, true. Maybe I am, but I love this job. That's for sure.
Yeah, no, that's good. That is, yeah, that's great. Okay, excellent. Well, until next time.
Perfect. Bye.